the largest South African medical schemes, AfroCentric, says it's been keeping a very close eye on COVID-19 hospital admissions. Now, AfroCentric Med Scheme Managing Executive for Clinic Risk and Advisory. It's Dr. Lungi Nyathi joining us now to talk about this. Dr. Nyathi, good morning to you. I know you told me off air the voice is a little iffy. I hope you're feeling okay. So thanks for still taking time to speak to us. Admissions and fatalities during this third wave. Compare this third wave to the first two we had. Good morning.
Morning. How are you?
I'm good, thank you. I can hear the voice is a bit scratchy, so I hope you're okay.
No, I'm okay. I'm okay. My voice is scratchy, but it is what it is. But in terms of admissions, we are seeing the admissions increasing daily. We're seeing about, in a week, about 2,000 admissions increasing for our med scheme universe. We look after 15 medical schemes, and we are concerned, really, as everyone is, about the state of readiness for our country to handle the third wave. Seeing so many admissions, we're going to have to pivot very quickly in order to be able to handle these admissions. In terms of fatalities, we haven't seen the fatalities increase to the rates that they were in the second wave. However, they are about the levels that they were in the first wave. I'm particularly concerned about the aged. We are seeing the admissions in the over 60 category being highest of all the three waves, and the fatalities in the over 90s are actually almost as high as the second wave.
So what, as part of the advisory element of your job as the executive, Dr. Nyathi, do you tell all these various medical schemes and medical partners that you're involved with? What's the kind of advice given here off the back of the numbers you've just been telling me?
Sure. I mean, there are several levels of advice that are important. There are things that need to be told to the medical scheme members, which is really the same as what is told to the general population about making sure that they get vaccinated, and also they follow the non-pharmaceutical protocols in preventing infection. The Delta variant, which is the variant that's circulating the most in South Africa now, is highly contagious. It's more transmissible, as we understand it, than the Beta wave, which is what we had in wave 2. And so it's important that the members know to vaccinate and also to prevent infection. Then there's a level of work that is done to help medical schemes prepare for admission. So, for example, some schemes have network hospitals, and what we do at a period like this, when we're seeing an increase in admissions, is we typically waive all the non-network hospital rules so that a member can go to any hospital that is available, even if they ordinarily wouldn't go into it. And then it's preparing financially to see that the scheme is going to be able to sustain the kind of increases that we're seeing.
Well, that's what I was about to ask you. What's the kind of financial damage, Doctor, that the various schemes are starting to experience with this increased number of admissions, the fatalities, of course, hospitalization, home stays, home care? What does the financial landscape for these various medical schemes look like? Are we at a point yet where we have to start asking questions about the longevity of these medical schemes?
We're not at that point yet. Most schemes, when they set their contributions for the year, they take into account the fact that there may be changes in COVID admissions. And you know, some admissions increase, others reduce. Some costs increase, others decline. So there are swings and roundabouts. But to answer your question, since the beginning of COVID, our medical schemes collectively have spent over 2 billion rand of money on COVID, various things from pathology tests to in-hospital. More than 60% of that expenditure has been in hospital.
And just before I say goodbye to you, Doctor, this is a fascinating discussion. I'd just like your thoughts on the admissions into hospital. Are you getting a sense from the medical schemes that there isn't enough hospital space? I'll tell you why I'm asking the question, because you were talking about the partner hospitals that you don't necessarily have to go. The advice was you don't have to necessarily go to the hospital you were allocated. If there was no space, you could go elsewhere. I imagine that's because there aren't enough hospital beds.
We do start worrying. I mean, we've seen an exceptional increase in number of admissions in Gauteng, obviously because Gauteng is currently leading the third wave. And And so we have seen in some hospital groups a really high number in admissions, almost the same as the second wave. And so we are starting to see people moving between the hospitals. We haven't yet had a high SOS from the hospital groups that makes us worry, but we do know anecdotally that there are some inter-hospital transfers, even interprovincial transfers in some instances. And so we're really watching that closely.
Oh, it's good to hear that you are watching it closely. There seems to be something of a plan here happening behind the scenes. What a pleasure. Dr. Lungi Nyathi, AfroCentric Med Scheme Managing Executive for Clinical Risk and Advisory, joining